Healing Wounds, Unveiling Discrimination in Healthcare Sanctuaries. Despite representing just 2.6% of the total population, Indigenous people account for 25% of drug addiction rate in Canada, and the numbers are merely increasing. 78% of Indigenous people reported experiencing anti-Indigenous racism in the healthcare system. Furthermore, 69% indicated reduced use of the system due to experienced racism. This video will portray what Indigenous people have been and are going through that limits their access to healthcare services. This is Inuk, an Indigenous man in Canada. He is currently battling with drug addiction and is seeking help from healthcare services. Sadly, many Indigenous people experience different forms of discrimination by healthcare services that make them uncomfortable and unwilling to access these services. Here are some examples.
Healthcare is a place that should be giving people support and assistance regardless of one's background, religion, or race. However, the reality is bleak. Many Indigenous people have shared stories of how many health regions in Canada have endorsed the practice of co-ed rooms in hospital settings. This decision fails to take into account the multiple forms of past and current trauma and violence that shape the lives of many Indigenous women. These policies can be culturally inappropriate to many Indigenous people, forcing them to feel uncomfortable while accessing treatment from these settings. Indigenous people are often treated by the healthcare system as if they are a problem that should be treated elsewhere. The image of the drunken Indian continues to be one of the most harmful stereotypes operating in healthcare settings. Experiencing discrimination and racism can trigger social anxiety, depression, and other mental illnesses that can cause people to go back to using drugs. Furthermore, the unique challenges and struggles faced by Aboriginal people who often face severe abuse and impoverished conditions from an early age are often major factors known to contribute to the development of mental illnesses, often PTSD. Discrimination in the healthcare system and society at large continues to a cycle of re-traumatization and low self-esteem that accounts in part for the problems faced in these communities.
Now, let's look at some examples of the consequences of this discrimination. More specifically, let's examine the impact on how Indigenous people interact with healthcare. Through interviews, it was found that discrimination causes Indigenous people to be on defense against workers. This is due to them expecting bad treatment, resulting in both parties being unable to open up to each other. In another study where a series of interviews was conducted, it was found that one female participant stated that she goes to healthcare as little as possible and only when necessary due to fear of judgment. Another participant stated that they tell healthcare workers as little as possible about their health conditions. And another man said that he lies about the drugs being used due to fear of even further levels of discrimination, which would affect the treatment process. Finally, some participants were said to avoid the healthcare system completely and just put up with the untreated illness and pain, rather than being subject to any unpleasant discriminatory treatment. Ironically, healthcare, a place where people should feel safe and comfortable, is instead a place where people feel anxious and traumatized. This results in people going back home without getting treated, causing them to use substances again. This plays a big role in why the drug addiction rate among Indigenous people keeps on increasing.
It is clear from the research that discrimination results in a considerable array of adverse effects, ultimately leading to a reduction in the quality of treatment for Indigenous people who use drugs. In the long term, these problems of discrimination and their consequences can be improved through both social policies and the efforts of healthcare providers. Anti-racism training sessions could be implemented for all individuals and staff working in healthcare. Resources could also be placed at the disposal of such training programs to decrease the lack of knowledge regarding Indigenous health. Healthcare workers themselves could also choose to take more time and effort with individuals who have had past negative experiences with healthcare, to rely not only on the possibly biased diagnoses made by past healthcare workers, to be more careful around the questions regarding substance use, as well as to stand up to racist remarks from colleagues in the workplace. Through these policies and decisions, discrimination against Indigenous people in healthcare can be mitigated one step at a time.